advocating for good healthcare for the LGBT plus community. And I know that's relevant across Europe as well because of these cultural taboos. In the UK, which is seen as a relatively progressive country, what we're seeing is 1 in 7 members of that community are avoiding healthcare altogether because they're afraid of discrimination. The health outcome of that community is abysmal, and it's my community, and it's really upsetting and it's really sad. And one experience which kind of made me think, because when I was first diagnosed, I didn't really get into LGBT activism. I didn't want to be a cliche, but like, I'm a gay man, so I have to be involved. That was my view. It was a very distorted worldview, but it was my view. When I became a member of the NHS Youth Forum, and I was able to do some incredible opportunities in front of policymakers, the NHS, and this one experience really changed my perspective on being a voice for people, because I am very aware that I also have a privilege of being able to speak out in certain situations. We were in Parliament, and I was just there listening to experiences, and we were listening to 3 young people, early 20s, who'd been diagnosed with cancer. One young man had come from the Asian community, come from Birmingham, had been diagnosed with cancer and had been closeted. He'd be a closeted young gay man for about 3 years, terrified of telling his family, and was diagnosed with cancer, and went into treatment, had to have a stem cell transplant. So he was in hospital and was finally able to have friends and family visit him. But inspired by the community online and people who were voicing, be who you are, do this. And he was just like, I'm going through chemo. I really can't be bothered pretending to be something I'm not. So he finally opened up about who he was, told his family. They disowned him. He went through his cancer treatment in hospital on his own. His sister only visited once and basically just said, yeah, mum and dad aren't coming back. And then this is where the healthcare thing comes into it. In the UK, destroyed going through treatment, told a nurse, oh, they've done this. And she said to him, oh, well, let's just deal with the cancer first and then we'll get to that.